My name is Taylor. I'm a registered dietitian nutritionist and board certified specialist in oncology nutrition. Today, we'll be talking about how to use and care for your brand new feeding tube or PEG tube. Stay tuned to learn more. Learning how to use a feeding tube can be really difficult when you've never seen one before. So I've enlisted some help. Meet Peggy, because she has a PEG tube. So when you first go home with your new PEG tube, it's very likely to be covered in gauze, perhaps a bunch of tape. It's very sore, and a lot of people are afraid to take the gauze off and see what's underneath, and now it's going into their stomach. In some cases, home health will come out and show you how to use it, clean it, and take care of it. But even if they don't, please do not worry. You can take care of it at home on your own. The first thing you need to do is thoroughly wash your hands with warm water and soap. Remember to clean underneath your fingernails, and once your hands are clean, then we can get started. Once your hands are nice and clean, it's alright to remove the padding that's around your new feeding tube. So be extra gentle, and if there's tape, make sure to peel it off very gently because the whole stomach area will be pretty sore after the new feeding tube is there. Now when you remove the final layer, you'll finally be able to see the actual part where the tube goes into your stomach. Now around that site, it might be a little bloody, and that's totally normal. If it's new, the blood might be red and fresh, and if not, it might be a little bit crusty. Either way, that's just fine. Now, if around the site when you take off the padding, it's green or pussy, that's a problem because it might be a sign of an infection. So please call your doctor if you notice that's the case. But with a brand new feeding tube, the only thing you should really see is a little bit of blood, and it might be dried at that point. So in order to clean this site, and this is how you'll clean it all the way through having it, you just get plain soap and warm water, and you can wash right around the site very gently. It's very tempting to want to use alcohol or peroxide and spray it on there and really kill all those germs. However, I don't recommend doing that at all because those will both sting the new site, dry it out, and make it very hard for it to heal. So it will be painful and make the healing slower. So please just use plain, unscented, boring soap and warm water, and that will get your feeding tube site plenty clean. When you have your new feeding tube, it is okay to turn it a little bit from right to left to rotate it, but do not pull or yank on the new tube because that will be very painful. So just as if it were like a new earring that's in your lobe, it's okay to rotate it a little bit, but just be very gentle as it will be sore those first few days. One of the things that you'll likely be using when you first get a brand new feeding tube is gauze. Gauze pads come in little packets like this, and you can buy them in boxes at the store, and they can also be sent to you by the companies that will provide you with supplies for your feeding tube. Now, I like to use the split gauze when it comes to the feeding tubes because it's easiest to wrap around the tube. They typically come in 2x2s or 4x4s like this one. When you want to put it around the feeding tube, what you'll do is you'll tug the split apart, and then you just pull it over and back together around the feeding tube. And it's a nice option because it gives a little cushion between your skin and the feeding tube. And during that first few days, it's also good because if it is bleeding at all, it catches whatever little bit of blood that there might be, makes it a little easier to clean it up later. Now, as you go through, some people choose to use the gauze pads the entire time and always wear one. Other people find that they really don't need it after that first few days, and they'll actually remove the gauze and just wear their feeding tube like that. So it's up to you. I recommend trying it both ways and see which you like the best, but during that first few days, I think the gauze pad will really give you more comfort. So a really useful feature that happens to be on most feeding tubes is these little numbers. Now, when you get your new feeding tube, take a look at the number that's closest to your skin. So if you look here, Peggy's at about a 1. Now, if you look down one day, and I'll use this feeding tube for these purposes, and you're normally at a 4, but all of a sudden it's at a 7, that means the tube is getting pulled in. And in that case, you should call your doctor and let them know that the feeding tube is getting sucked in. Now, let's just say again, you're normally at a 4, And one day you look down and closest to your skin you see a 2 or a 1. Well, that means the tube is coming out. And again, you should call your doctor and let them know what's going on, and they'll tell you what to do from there. However, even though that can happen, it doesn't happen very often because, as I showed in the last video, there's something holding it in on both sides, whether it's a little mushroom or a balloon, and then you have something holding it on this side too. So there's not a lot of wiggling that goes around with the feeding tube, but just in case, know what your number is so that you can keep an extra close eye on it. Now when you're looking at your new feeding tube, you might notice that there's some fluid building up in the tube, and that is actually very normal. What you're seeing most likely is stomach juices. You might also see some chunks floating in there as well, and that's usually just the last thing that you ate. The main reason people worry when they look down at the tube is if they see red, because they think it's blood. If it is blood, you should call your doctor immediately, but before you call your doctor, think about the last few things that you ate. If you've had something red, like spaghetti sauce, red wine, beets, like red Kool-Aid, fruit punch, red velvet cake, something really bright and red, it might just be that you're seeing in the tube. So keep that in mind, that what you eat will change the color of the fluid in the tube. And if you haven't had anything red to eat and you're still seeing red in the tube, then call your doctor. But in most cases, it's just something that you ate. Now, there are ways to clean out the tube and to get that fluid and any chunks you might see out so that it looks very clean. And that is through flushing, which is how you are going to clean your tube the entire time that you have it. And we'll be talking about flushing the tube next. So flushing out the feeding tube is actually pretty easy. You only need 2 things, water and a giant syringe, a lot like this. Now, flushing the tube is something that you should do every day to keep the tube clean. Just like you would brush your teeth every day, even if you weren't really eating very much, you should still flush out the tube every day, even if you're not yet using it for formula, just so you can keep the tube clean. Now, before you get started, what you'll do is you'll take your tube, and you might notice some stomach juices in there. That's totally normal. If you have a clip like this, that probably stops the stomach juices there. But what you'll have to do is open the clip so it's not pinching the tube, so that the water can flow through freely when you're ready to do the feeding and the flushing. We're just going to do flushing first. Now what you'll do is you'll take this syringe. I know it looks like it holds a lot, but it only holds about 60 cc's, which is 2 ounces or a 1/4 cup. And so you'll only be doing about a 1/4 cup at a time. And you will stick the syringe right into the end. And you might notice that some feeding tubes have 3 instead of just 2 like this one. And like I said before, some will have a clip and some won't. Each one's different, but the flushing process is the same and very simple. So when you're ready, you'll just take the water and pour it directly into the tube. You can fill it up all the way if you want. And because this is controlled by gravity, what you'll notice is if you lower down the tube, it goes down very slow. But if you want the water to go in more quickly, you raise it up and the water will go through very, very fast. So keep in mind too, with the water, if you laugh or cough or sneeze, the water might bubble up a little bit. So don't worry, that's very normal. And then if you want, you can just keep going to make sure you get enough fluids. And like I said, if you do want to control the speed, up to make it go faster and down to slow it down. Now once you have all your water in your feeding tube, then you're good to go. Flushing is that simple. You'll just take out the syringe, close up the end of the feeding tube, and make sure to close off your pincher. And then you're all done flushing your feeding tube. Be sure to do it at least once a day, and you're welcome to do it more than once a day to keep your tube extra clean and help yourself stay extra hydrated. Thank you so much for watching my video about how to keep your feeding tube clean and how to flush it. Be sure to check out my other videos on why you need a feeding tube and how to do actual feedings. My name is Taylor, and I hope that you have a happy and healthy day.